Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about hypovolemic shock. Shock is decreased tissue perfusion that leads to hypoxia, decreased oxygen supply to the tissues, and if it happens due to low volume, that is low blood volume, it is called hypovolemic shock. So hypovolemic shock is due to the low blood volume or low fluid volume within the blood vessels. Now, what are the causes? What leads to hypovolemic shock? Massive bleeding. It can be from surgery, GI bleed, any trauma, anything that leads to a massive bleeding that can lead to hypovolemic shock. Excessive fluid loss secondary to diarrhea, especially in children, or vomiting, excessive sweating, it all can lead to hypovolemic shock. Certain condition, example burns, pancreatitis, and this is because due to the third spacing of fluid, that means fluid moves from the blood vessels to the tissues, secondary to the increased capillary permeability. This all can lead to hypovolemic shock. Let's see the pathophysiology of hypovolemic shock. So in hypovolemic shock, there is decreased venous return, decreased blood return back to the heart. As a result, the preload decreases. Preload is the ventricular stretch, and it depends on the blood volume. So blood volume decreases, preload decreases, cardiac output decreases. When cardiac output decreases, the blood pressure drops because blood pressure depends upon the cardiac output. As a result, what happens, a sympathetic nervous system gets stimulated, your heart rate increases, blood vessels constrict to increase the blood pressure. So there is an increase in heart rate. When the blood vessels constrict, the afterload increases. Afterload is the pressure with which the heart must work to eject, to pump blood. When the blood vessels constrict, heart has to work more to pump blood. So afterload increases. So what happens with the decreased blood pressure? Perfusion failure. Tissues are not getting enough oxygenated blood, that leads to tissue hypoxia, which can lead to organ dysfunction and multi-organ failure. Now let's see what are the classes or stages of hypovolemic shock. Hypovolemic shock are divided into 4 classes or 4 stages, and it depends upon the fluid volume loss, because signs and symptoms depend on the percentage of the fluid or blood loss. So the class 1 is less than 50%. That means average human blood volume is 5 liters. So less than 50% of blood loss is up to 750 ml. Usually with 750 ml of blood loss, cardiac output can still remain normal. As a result, patients are usually asymptomatic. Now class 2 is 15 to 30% of fluid or blood loss. That is approximately 750 to 1500 ml. Class 3 is 30 to 40%, that is approximately 1500 to 2000 ml. And class 4 is greater than 40%, that is greater than 2000 ml. You have to remember, as the blood loss goes higher or the class goes higher, the patient may present with increase or worsen signs and symptoms because of the increased fluid or blood loss. Now let's see what are the signs and symptoms of hypovolemic shock. The signs and symptoms, definitely the low volume can lead to low blood pressure. As a result, the sympathetic nervous system gets activated, your heart rate increases, the rate increases to increase the blood pressure or to increase the oxygen. Decrease urine output. This is because of low blood supply to the kidneys. Diminished or poor peripheral pulses, again low blood supply to the peripheries. Skin becomes cool, mottled, and capillary refill greater than 2 seconds. Patient may present with confusion, anxious. It's because of the low blood supply or oxygen to the brain. The blood volume is low. As a result, low central venous pressure, low pulmonary arterial wedge pressure or pulmonary capillary wedge pressure. Now, what are the management of hypovolemic shock? The management include treat the underlying cause. Well, if it is due to the GI bleed or bleeding due to an ulcer, endoscopy is done, cauterized or clipping is done. So treat the underlying cause to prevent further bleeding. The primary management include IV fluid. Fluid resuscitation is the key management in hypovolemic shock. Usually crystalloid, that is NS or LR is given, or colloids, example albumin is given. Blood products, example PRBC if blood loss, or FFP if needs clotting factors, or if the platelet is low, platelet transfusion is done. Once the fluid resuscitation is done, inotropes are administered to increase the blood pressure, example Levophed, vasopressin, etc. So today we learned about hypovolemic shock, and thanks for watching my video.